Health equality issues are one of the biggest problems in our current healthcare system. We have some of the greatest healthcare in the world, but we also have some of the worst outcomes in the world.
Health equity is impacting our communities, our families, our bottom line in terms of gross domestic product. It's impacting whether we can compete on a global stage. It impacts everything. And so I specifically came to SOM because I wanted to be able to address health equity and cost in the healthcare space.
In the course Population Health and Health Equity, we begin to teach students how to integrate these two frameworks. One, population health. How do we improve the health of communities, groups, rather than just the individual? And health equity. How do we create an environment where there's opportunity for everyone to achieve their best health and well-being? The clinical care we deliver is only 20% of how people actually do and health over time. And then a lot of things outside of the clinical environment are maybe even more important, right, than what we do within the clinical setting.
So thinking about it outside of your biomedical approach, like someone has COPD, they have asthma, they have heart problems, well, they also have problems with getting to appointments. They have transportation problems. They have low education, low literacy levels. How do we incorporate that into healthcare, and how do we actually help people so that they can better their own health through addressing some of these social and structural determinants of health?
Here you'll see that individuals identified as Black have double compared to everyone else that has a college education. That's really striking.
I think that I have a lot of anecdotal experience about population health, see them in an emergency room, but I've never really taken an analytical approach to it or thought about why these disparities exist, and so this course definitely provides a framework for that.
We need to think more broadly. Like, this is an inequity issue that needs to be tackled from like a social justice perspective. And so that kind of language, I think, was really helpful to me to then bring back to work.
We've been developing group exercises in our class. This time we are taking modified real data from a healthcare organization that provides an overview of what population might look like, including their cost, what their makeup is, and then asking students to actually use that and come up with a population health strategy.
This is particularly relevant to me as someone who practices in an emergency room at a big hospital. I think that immediately what I can do with this is go to my own leadership and say, I know that some of the things that we face in the emergency room dealing with equitability, how to get reimbursed for certain types of patients, maybe we can apply like a more structured process to this.
So the diversity in the cohort is really a beneficial component of the entire program. Being exposed to people who work in pharma or work in healthcare operations or who work in healthcare finance or IT development is really eye-opening in the sense of how do they approach problems, how do they think about things, what are the issues that they're facing. When
you put all those people together, you often get these really interesting conversations and ideas that if you had everyone that was just a nurse or a MD or etc., you wouldn't get that.
As we think about the social needs of our patients and the medical needs of our patients, we have to do differently and we have to do better to be able to attain the goals we want and make sure we have the health outcomes we need. And so this is a key tool for the students here, and we're excited to be able to offer that to our students, and it's one of the many gems here at Yale.